Need to show you some movements for contractions.
Yeah. Please.
Okay. So I'm going to pretend that Allison's having a contraction. So I'm going to talk her through one, and then it's your turn.
Oh.
You'll mimic that.
Okay.
Okay. So Allison, we got a contraction coming on, and you're just starting to feel it kick in.
Okay.
And I'm going to put a reinforced hand on your sacrum right here. Okay, and then I want you to breathe right into that sensation. And I don't use the P word, I don't use the pain word. I keep it so it's got neutral association. Because it's a strong sensation, and that's what we want her to just stick with, the strong sensation.
Okay.
So just let that build up and breathe right into the very center of that sensation and just let it get a really big feeling. And about at the peak of that sensation, I'm then pushing for all I'm worth. So I've got both hands on, then we're coming down the other side, and I keep steady pressure, Niko, I don't let it up. And nice deep breaths, Allison. Yep, just focus on your breathing and let everything drop down. Let your jaw drop, let your shoulders drop, all the way down to your toes. Just let it drop right down. And now we're at the end, and there's no more sensation, and I just stay on it like this. And then I lighten up and I do this kind of thing. This is what I call a release stroke, and it's a confusing stroke so that she doesn't remember the handprint on her back.
Okay.
So that I try, how's that now when I'm not touching you? Can you feel where I was pressing?
No.
So this light skin stuff is very confusing, and it's an eraser.
Okay.
So we don't want it to build up that after a couple of hours, you know, she's got these paw prints on her and she won't take it anymore. So we have to erase every time. Okay? So you can go in, and what I'll do the first time, Niko, is I'll coach you through, and then you can have her all to yourself on the second one. Okay? So you just get one hand on the other, so she's got a contraction building up. Okay? And then you start to put steady pressure on, but not everything you've got. Okay, and then she's got deep breathing right into that set of hands on your back. Really big breaths. Make each breath a little bigger than the one before, and stay right concentrating on the sensation building up for that squeeze, because we really want that baby given a good squeeze with that contraction. That's good. Keep your focus right there. Now we're at the peak. You can really push on her. And keep breathing. Use your breathing with a real emphasis on the out breath. Deep in, that's better.
There you go.
You got it. Push it out. All the way up, all the way up, all the way up. Yeah, yeah. And now we're coming right down the other side. So it's diminishing quickly. And you stay steady and you lighten up a bit on her lower back. That's good. Now it's completely gone. And you want to take one more really good deep breath. And then you just really, you can massage it a bit, but you always want to finish with that very light fingertip stuff. It's kind of the tickly idea. And then it's good to check with her. Did that erase it?
How does that feel?
It's good.
Okay, good. Okay, and then you can have one all to yourself.
Okay.
I'll tell you how it's coaching up. And it's always good, which I didn't bother doing, is telling you, you're doing good. Just keep breathing. Great job, Allison, stuff like that. The more you use her name, the better. Or whatever your endearments are, you know.
Okay.
Just don't swear on camera. Okay, nice deep breath. Away you go. Keep her with you. Talk to her.
Okay. So you're having a contraction now.
Yeah, and tell her to focus on what
You
you're
want
doing.
to focus on the pressure that I have on your back. Let's take a nice deep breath into my hands. Breathe deep, deep, deep. And let it all out. Just let everything relax and go calm. Just keep breathing deep. Nice and deep. Let it out. Easy.
Good.
Now you're at the height of the contraction. Just keep breathing. Breathe deep.
Keep your focus.
Nice and deep. Long. Let it all out. You're doing good, baby. Another deep breath. How does that feel?
Good.
Okay. Yeah.
And I always say, let yourself go way, way down now. And just go for a rest. And we'll massage you. And you'll just come up with the next one. And we'll be right there to catch you. That's good. That's excellent. What you did was excellent. And I would just say more of what you did. Good work. That kind of thing.
Okay.
It's amazing how it's just one contraction at a time can get you through hours of contractions. Because you might be and then do long ones like this, Niko.
Okay.
You might be starting with a contraction every 10 minutes, but it's a real bullet biter. And then what they say is call me when they get 3 minutes apart and 1 minute long. It's like, oh, jeez. It's like heading right into the blizzard.
Okay.
But it might be a gradual startup, you know, a little bit of snow, and then it might not really seem like it's picking up fast enough. And with other people, it starts right in. 3 minutes apart, 1 minute long, and there's no break at all. So you can't tell ahead of time, but it's good to practice that and really good to talk her down.
Okay.
You know, and the idea that it's positive. Like, don't resist the sensation. Like, just go straight for it.
Okay.
Okay, good. Okay, so I think that we've got lots of strokes that we can use here for your back massage. And you've got really good practicing. I would practice every week before the massage is completely over. Do that kind of stuff.
Okay.
And let's give her arms a good squeeze here. And let's do this too. There we go.